Hi, I'm Erikka Gilliam, and I'm a data manager here at the Urban Health Collaborative in the Data and Research Core. Uh, I primarily work uh, under the West Philly Promise Neighborhood Initiative, the data manager. I work to collect data on our programs and services. One to determine whether or not we are making an impact, but also be able to give that data back to the community in which we serve so that they can use it for action. DASH is a national initiative that looks to provide new and better ways to share data across communities. And so, one of those programs that they offer is the DASH Mentor program. And that program allows subject matter experts in different aspects of data sharing to then mentor other agencies so that they, in whatever skills they want to develop in order to be able to better share data in their communities. Yeah, so I partnered with Bob Graddick from the University of Pittsburgh to work with a total of 6 mentees. And so Bob Graddick being a more seasoned mentor, since he was a part of several previous cohorts in the Dash mentorship program. And so we worked together to mentor 6 different mentees across the country. The goal of the program was to first identify the goals of each agency. So each organization determined at the beginning of the mentorship program to determine what were their goals. What did they want? Where did they see themselves after the 9-month program? So I primarily worked with the mentees who were focused more on needing help with data governance. So establishing data use agreements, developing protocols, uh, helping with creating different ecosystem mapping where you would take your data in each of your different departments or each of your different agencies to see where was data lacking, who was sharing data and who wasn't sharing data, and who still needed to share data within that ecosystem. In any field, mentoring is important just because it's one thing to learn things through textbooks, lectures, and you can go to all the webinars you want, but to be able to have one-on-one mentorship where you can get that feedback and then get those resources. So in public health, I think these mentorships where people who have already gone through all the tests and trials, specifically with working in these different agencies where, especially with different government agencies where things take a long time. And so if they take a long time, it's good to work with people who have gone through all of the troubles, have already figured out all the pitfalls, that they can help you to be able to move forward faster. I think one of the best things to know is that a mentorship goes 2 ways. So while I gave my expertise to my mentees, I learned just as much from them than they learned from me. And my favorite part of this mentorship program was just the opportunity to collaborate with so many different people from across the U.S. because I think specifically with my role, I typically only work with people within the Philadelphia area and most times even just within the West Philadelphia area. And so the idea to use my expertise that I've learned in such a small geographic area to be able to then use that to apply for people who are all the way as far as New Mexico. I thought that was really rewarding, and I definitely took home a lot of nuggets that I'll now use in my work. So I think that was a really rewarding opportunity for me. For more information about the Urban Health Collaborative, please visit us at drexel.edu/UHC. Thank you.